2007 to come out with a diabetes prevention initiative where they decided to inform Americans on how to lower their risk of diabetes and heart disease. Again, how effective has this been? So, what can we do to conquer this epidemic? We must do something, or half of us by the year 2020 will be pre-diabetic or diabetic. Just today, we have over 26 million people with type 2 diabetes, and that's increasing at the rate of 3 million cases every 2 years. And it's increasing more than that every 3 years. The associated cost of this is about $174 billion annually, and that also is increasing. Now, in addition to the known type 2 diabetics, or type 2 pre-diabetics rather, there are over 57 million people who are pre-diabetic. That's twice as many as the number of known diabetics. Now, having pre-diabetes, which is a blood sugar between 100 and 125, which most physicians and patients alike ignore, you have a 10-fold chance of developing diabetes within the next 6 years than if you didn't have pre-diabetes. 65% of pre-diabetics today will be diabetic in 6 years. Now, we have plenty of time then to do something. Diabetes doesn't occur overnight. Every patient with type 2 diabetes, unlike type 1 diabetes, which can occur very quickly, type 2 diabetics go through this evolutionary phase of gradually increasing their weight and increasing their blood sugar, a time that we can intervene. And why is this important? It's important because pre-diabetes is the heralding event for type 2 diabetes. And there are a number of major complications that can be prevented by intervening. These complications fall into 3 categories. The first is what we call microvascular disease. That's small blood vessels in the kidneys, and the nerves, and in the eyes. And the microvascular complications of the eyes causing retinopathy is the #1 cause of blindness in America today. It can be prevented. Peripheral neuropathy is the #1 cause of nerve damage in America today is type 2 diabetes, which can be prevented. And macrovascular complications, that means the bigger blood vessels has an acceleration of atherosclerosis, and we end up with heart attacks, strokes, and peripheral arterial disease. And if you don't believe this is important, 75% of people with type 2 diabetes die of a heart attack or a stroke. These can be prevented. With detection and early intervention during the pre-diabetes phase, these complications are preventable, and failure to intervene will assure the disease progression. So what can we do? First, there needs to be an enhanced public awareness of the diabetes epidemic and who are at risk. Who are at risk? #1, if you have a blood relative who has type 2 diabetes, you may also have the dormant gene of type 2 diabetes, and you may be at risk, especially if you begin to put on pounds. It used to be middle-age spread was when we would see the onset of type 2 diabetes. I can tell you in my office today, I see teenagers who have teenage spread, and their diabetes is occurring, type 2 diabetes, early in life. So, positive family history and being overweight are the 2 major risk factors. Living a sedentary lifestyle. Kids today don't sit on a bicycle seat anymore. They sit behind a computer. They're not getting exercise, and they're gaining weight. The presence of cardiovascular disease may already be there. High blood lipids and high blood pressure. For women, a history of gestational diabetes, that's the temporary diabetes that sometimes occurs in women during pregnancy when they have the gene for type 2 diabetes. Or if they deliver a baby more than 9 pounds, they may probably have pre-diabetes. Or if they have a condition called polycystic ovary disease. These are the people who are at risk for pre-diabetes and eventually evolving into type 2 diabetes. Now, these persons should be screened annually, and this screening should probably now be done in the teenagers and every year. I had a child in the office the other day whose mother brought her in because the mother had diabetes, and she happened to check her daughter, who was beginning to blossom as a young woman, even at age 11, and that's happening more often in this country today. And this young girl who had gained significant weight, and I was looking at her and I thought, she's 11 years old, she's only a year older than my grandson, and look at her, she's already over 160 pounds, and she has type 2 diabetes. And this can be reversed. Even though she's progressed from the pre-diabetic stage to type 2, if you get it early enough by the same kind of blood interventions with lifestyle changes and medications, you can reverse this disease process. It's not a given that you must progress on to type 2 diabetes. So once we've determined that a person has pre-diabetes, what are our therapeutic obligations and options? Well, first of all, we need to educate the people that the clinical risks of not treating pre-diabetes and the ease and benefits of reversing it. Now, as pre-diabetics may have the same comorbidities as a full-blown type 2 diabetic, we need to take a comprehensive two-track approach to treating this. I gave a lecture at the very first day of Hope here when Jim Cook was president, and at that time I said that diabetes is not just hyperglycemia anymore. It's not just glucose anymore. Type 2 diabetes is what we call now the metabolic syndrome, which encompasses the cardiovascular risks of high blood lipids, high blood pressure, as well as high blood sugar. So the two-track approach is very simple. First of all, we need to lower the blood sugar to normal. And we can do that with lifestyle changes in a pre-diabetic. Reverse them back to normal. We do that because we want to prevent the microvascular complications, the retinopathy, the nephropathy, and neuropathy. And we also want to prevent the patients from having complications from infectious disease. This is where lowering the blood sugar is most important. For the prevention of the macrovascular complications, heart attack and stroke, lowering the